If you're considering or preparing for hip replacement surgery, you may find yourself spending hours online trying to find out what's normal, what's not, how to go about your surgery, how the recovery is going to take place, if you can get back to exercising, yoga, the activities you love. If you find yourself in this position too, like I was before my first surgery, then this is the video for you. Before my first replacement, I had so many questions, concerns, anxiety as to whether I could still compete, whether I could still lift weights, jog, do yoga, all the things that are so much a part of my identity. And maybe you can relate to this. I didn't have a guide or a roadmap to tell me how to prepare or how to set up my home or how to think about the surgery. So I created that roadmap through 𝗛𝗶𝗽. This is the guide that I wish I had. In this video, I'm going to walk you through 8 of the many points that are in 𝗛𝗶𝗽s. Number 1, choosing the right surgeon who's right for you and the activities that you want to continue. So if you live in an area of the world where you can choose your surgeon, then I highly recommend that you meet with 2 or 3, even better, to find out about the surgeon's experience and ask them specific questions, which we'll get into next. So don't just go with your neighbor's surgeon or Aunt Sally's. And Aunt Sally may be a couch potato, or maybe she walks a little bit. Nothing wrong with walking as exercise, but she's not as active as you are, so it's not necessarily the right surgeon for you. And there's more information about choosing the right surgeon within the 𝗛𝗶𝗽s course. Number 2, ask better questions of your surgeon so you get more out of the appointment. So maybe you'll have 10, maybe 20 at most minutes with the surgeon, and it's really important that you ask them specific questions. And if you don't understand something, then ask them to break it down in plain English so you're very clear about what they're going to do and what it means for you. So ask them about preparation, ask them about the surgery day, what to expect, ask them about recovery, and also exercises. And can you jog? Can you do yoga? Are you going to have permanent restrictions? Also, very important to know how many of these surgeries, hip replacement surgeries, they do annually. The greater amount of volume, the better. You'll also want to know what approach they use. Is it anterior, posterior, lateral, and what restrictions they may have for you in the first few weeks. Within the 𝗛𝗶𝗽s course, I have a curated list of questions to ask for preparation, surgery day, waking up from surgery, and after physical therapy, if you get physical therapy. Number 3, managing anxiety and mental stress. So of course, beyond your physical pain or limited range of motion, there's so much going on emotionally, anxiety-wise, and the more that you're researching online, I remember this, the more anxious you are, because nothing is cut and dried. Everybody's experience is different, and you never know how you're going to come out of this, and you're not sure what to do to make the result the best it can be. And very few doctors or people are talking about the mental state, the mindset that goes into preparing for and even recovering from surgery. A simple thing you can do today to calm the nervous system and get back a sense of groundedness is box breathing. That's where you would inhale for 3 or 4 counts, hold for 3 or 4, exhale 3 or 4, and again hold for 3 or 4. So it's cyclical breathing with holds, exhale, and hold. And that really, really helps to calm. You can even do it at night while you're lying in bed if you're having a hard time sleeping. And within the 𝗛𝗶𝗽s course, there's not only various breathwork practices, but other modalities to help you stay calm, grounded, and centered. Number 4, preparing your body before the procedure. So if you're working out, doing resistance training, that's great. If you're not, please start, because the stronger you are going into the procedure, the better it's going to be for you when you come out and start to recover. So of course you want to strengthen your legs, your hips, your core, but also your shoulders and your arms. Why? Well, when you come home from the hospital, you're going to have a cane or a walker, maybe even crutches, and you're going to have to utilize and rely on your upper body for a while that hip is healing. You'll also need your upper body to get yourself on the bed or on and off the sofa, in and out of a car, so it's really important. Don't forgo your upper body. And for your lower body, of course, there's squats and split stance. You want to do some balance work, single leg step-ups, bird dogs, and planks. And inside hippies, I've got full body video workouts with progressions, regressions for every level so that you can not only go into your surgery prepared, but then also start to get strong again after your physical therapy has ended. Number 5, setting up your home as your healing sanctuary. So what are the items you're going to need, not only by your bedside, but need for recovery? And what are the items that aren't that important? What pillows do you need, and what kind of pillows for this kind of sleeper that you are, side sleeper or back sleeper? And how do you sleep on your side once you've had your procedure? How do you set up your kitchen and your bathroom? And what about footwear? Should you be wearing socks? Should you be wearing flip-flops? One of the things that I absolutely love are Skechers slip-ins, and they're very popular with people who've had hip replacement because you don't necessarily need socks. I don't recommend using the sock, the sock helper, because it's just more work for you. Just put your foot in the Skechers slip-in and easy breezy, you're on your way. And inside the Hippies course, I've got an extensive list of items that you will need, items that are optional, and every single thing you can think of to set up your home as your healing sanctuary. Number 6, knowing what's normal at each stage of this journey. And it is a journey. So after your procedure, even before your procedure, you may feel things like numbness or tingling. Afterward, you may stand up and feel the hardware of your new hip, or you may sense a leg length difference and you're wondering, is this permanent? Is this something I just have to live with? What you need is a roadmap to help guide you from preparation to week 1, week 2, all the way to week 12. Now, of course, every person is different, but in general, these are the things that are normal to feel or normal to experience. And then what is a red flag, in which case you want to contact your medical team. Number 7, understanding how recovery actually unfolds. So after the procedure, we'd like to think that our recovery is going to go like this, in a nice linear progression, and it doesn't always happen that way. In fact, it rarely happens that way. Again, emotions and anxiety can happen before surgery, can happen after surgery. We can still have a lot of pain afterward, especially if we're not taking our pain meds as scheduled. Inflammation can creep up, or achiness if we do too much. We feel good on one day, we may not feel so good the next day. So we just have to listen to our bodies. Again, work with those mindset practices that I have in the course and the workout progressions that are very slow, very steady and gradual after your PT has ended. And number 8, what are you going to do after physical therapy ends? If you get physical therapy, are you going to go back to yoga? Are you going to go to the gym? What weights are you going to lift? Are you going to use machines? Are you going to use free weights, dumbbells, barbell? What is your plan? There should be a progressive plan, and it needs to be very thoughtfully carried out. And you'll heal properly and get back to your activities gradually if you don't overdo it, and once you're healed, if you don't baby yourself and underdo it as well. One principle to remember once you've had your procedure and you're out of physical therapy, in the few months as you're working out on your own, is that regaining strength is imperative before flexibility. So you don't need to stretch the new joint. You don't need to see how far you can push it while it's still healing, even up to a year after the procedure. You want to build strength first before any flexibility, and the strength will bring about stability. That's what your new hip needs. And that's where I've got you, with balance, stability, some gentle stretching, not pushing into the end ranges, strength, modifications, progressions to get you back to your active life. A total hip replacement is not the end of your active life. It's just a new chapter, and it needs to be handled with respect and proper preparation. That's what I'm here for. Hip ease is everything I wish I knew before my first hip replacement, and everything I've learned and experienced along the way to help you get back. If you enjoyed this video, please share, like, and subscribe. More information down in the description.